Broadcasting live from RISKWORLD 2022 at the Moscone Center in San Francisco, it's time for Workplace MVP, brought to you by R3 Continuum, a global leader in helping workplaces thrive during disruptive times. Now, here's your host.
Hey everyone, your host Jamie Gassmann here, and I'm broadcasting from RISKWORLD 2022 in the Expo Hall in our show sponsor's booth, R3 Continuum. And joining me is Gerry Stanley and Mark Moore from Harvard MedTech. Welcome, gentlemen.
Hey, thanks for having us.
Thanks for having us.
Yeah, so tell me a little bit about what Harvard MedTech does.
Gerry's got this.
So we're a virtual reality company that couples virtual reality with behavioral health interventions to treat the effects of workplace trauma. So as opposed to looking at pain, depression, anxiety, or PTSD as the actual problem itself, we really look at that as a constellation of symptoms that we want to treat to give a very holistic biopsychosocial approach to how we're treating patients.
Wonderful. So tell me a little bit about, from a risk insurance perspective, if they have a client, what types of situations from a trauma perspective are you seeing most commonly that their employee would benefit from your solution?
So we really focus on claimants that are, I'd say, in the most volatile state. And if you really look at the data on that, most of those patients have some sort of an underlying psychosocial issue that's driving it. So it's really not a functional biologic issue. It's something else in their life, an underlying issue at home, a history of depression or anxiety. Those are all the things that really disrail recovery for patients. What we want to do is say, let's address them holistically. Let's treat the person as a person, not just as a disease or a traumatic event.
So tell me a little bit about how does that virtual reality work? Like what is that claimant experience when they're in that virtual reality?
So what will happen is we call the claimant, and as part of that, we're going to do some assessments on the patient, match them with one of our personal clinicians. We then mail the virtual reality headset to the patient's home so they can engage in it as much as they'd like. From there on, every week we have our personal clinician engage with the patient. So every week we're adjusting what they're doing in the headset. We're going to adjust when they do it, how often they do it, how long they do it, and what types of programs that they're doing. So our program is designed to have 4 what we call experiences. Okay, those are the categories. So we have knowledge, meditation, distraction, and escape. Okay, and what the escape is, it's escaping. It's going to see the towers of London, swimming with dolphins. It's taking an injured worker from the safety of their home to let them go transcend that and go into the world. The meditation is very basic eye control, breath control, body awareness meditation, but because they're in a virtual reality headset, it's incredibly immersive. So it's very simple meditation done at a very high level. The knowledge pieces are much more simple. It's education and empowerment. Because most workers will say, I really didn't get a lot of education from my clinician. Like the doctor doesn't tell me what's going on. So we really want to empower our patients to be active participants in their care and let them know that it's not realistic that you've had an injury, that you'll always have a little bit of pain. Pain is normal. That's a normal part of the healing process. So having zero pain is not how you get back to work. We have to get to a point to where that's realistic. And then we also have a distraction phase where if we've got patients that are experiencing pain, we know that we can put them into these modules, and in 3 to 5 minutes, we can get a 44 to 50% reduction in their pain immediately. And that pain will last anywhere from 2 to 3 hours with a legacy pain relief. So if you think about that in terms of pharmacology, that's what we're seeing when somebody takes a Percocet or a Vicodin or one of the opiates that people talk about. That's what you're hoping for, is a 50% reduction in pain that'll last 2 to 3 hours. We're seeing that in a completely non-pharmacologic way just by using virtual reality.
Interesting. So the ideal claimant is somebody who suffered some type of a traumatic injury that's causing them ongoing pain. And so this could be used as kind of a pain management tool for them, basically, correct?
We're definitely an adjunct for some of the pain. So we really focus on areas where we see the greatest needs. So we focus on shoulder surgeries, back surgeries, foot and ankle surgeries, amputations, or specific injuries that we know have really the lowest return to work, highest postoperative complication, highest opioid addiction. What the surgeries that are going to have the most likelihood of having a complication. But then we also like to identify claimants based on some of their underlying psychosocial issues. So they may have issues that are driving that. Like I said, maybe they're caring for a child at home. Maybe they're caring for an aging adult or a parent. We're seeing that a lot more. We have multi-generational families in the home. So we want to make sure that we're addressing these folks, saying, what's going on in your life? So that it's not just give this to everybody, but let's really identify the high-risk claimants early on to give them that extra level of support so that 1, they can get better, 2, they can be whole, and then from the insurance industry side, we really want to be able to close that claim.
Amazing. I know you had an interview earlier today, So, Mark, do you want to talk a little bit about some of the things that the journalist was asking you on the interview that you had?
Oh, it wasn't me that had the interview. Actually. I was not allowed at the table.
Yeah. Oh, wow. But you were allowed at my table, so you get to talk about it.
I was in a client meeting. So Gerry was the one that actually was with Best TV this morning.
Okay. Yeah.
So
tell us a little bit about that interview, because you were pretty excited about that. So.
Well, it kept me from running the 5K this morning. So
I know, you missed out.
That's excitement in itself.
Yeah.
So they're outside running in the cold. I'm inside on TV. So,
but it had amazing views.
Life was good. It was, it was a lot of fun. It was Best TV. They were just kind of looking at different innovators in the industry, and they brought us in to talk about advances in telemedicine and some of the new, I would say we're a little bit revolutionary, bringing virtual reality into the space. So how we're disrupting the space and what we're doing to really bring technology to healthcare, or really adjust where care is received. For the most part, care has always happened in the clinic or in the hospital. Yeah. Now we want to do it in patients' homes. Like, let's actually go where the patient lives instead of having the patient go to where the care has historically lived. So it's really that paradigm shift of going to where people live and meeting them where they are, so that we can really try to find the right care for the right person at the right time.
Yeah, and and you think about it, like the shift over the last couple of years where, telehealth and people being able to, have appointments right off their phone to diagnose them, this is a really prime opportunity in time where people are starting to get used to that care in the home. So that's great.
Yeah, because we've talked about telemedicine for probably a decade, but patients didn't like it and doctors hated it. So you've got this great idea that nobody wants to utilize in the pandemic. That's really kind of the blessing of the pandemic, is it forced us to get out of that comfort zone, and now people love it. Mm-hmm. I know doctors that have moved straight to just all virtual practices because it's so convenient and it's just less disruptive to everybody's life. So it's been fun just to see that evolution in such a short period of time.
Yeah, and what I like about your virtual reality and trying to help that pain management is that shift away from having to take a narcotic, an opioid, to treat a backache, and you hear so much about the opioid crisis. I mean, I know I haven't heard as much about it. I think COVID kind of silenced a little bit, but I don't think it went away. And so, this is really a great kind of alternative to those who are like, I really don't want to take something to handle my pain. I'd really like to have some type of a solution that allows me an alternative option. So that's great.
It's been really great. It's a lot of fun to be doing something so innovative but still helping people.
Mm-hmm. Yeah, that's fantastic. And I know you guys are exhibitors here at the conference. So, tell me a little bit about some of the traffic and the conversations you've been having. How are people responding to you?
It's new. It's novel. So for us as an organization, it's something that's not been in the marketplace. Everybody's talked about the biopsychosocial pieces that go into the claim. We're actually putting an appliance with that, with therapy. So it's having a lot of, what are you guys doing? Oh, can I try that on? And they take it as an Oculus. They look at it as a kid's game or something along those lines. And once they actually sit down and get immersed in the system within the VR headset, they then see the difference of what that can have for the patient. And hearing the story that goes along with that and the science that's been brought to fruit, we're having tremendous amount of traffic and a lot of people kicking the tires and saying, there is a solution here. How do we apply this in our organization and for our claims?
Yeah, that's fantastic. I can imagine. It's always great to see something new and innovative that maybe somebody hadn't thought of, or maybe they thought it needed to have a solution there, and you guys kind of brought it to market. So that's fantastic.
Thank you.
So if somebody wanted to get a hold of you and learn a little bit more about what you're doing, how would they do that?
Well, you can go to harvardmedtech.com. There are places that you can send a referral in, ask for information.
You could go to info@harvardmedtech.com. That's a great place. Send an email to that, and we'll be able to communicate with you directly. We also have referrals at harvardmedtech.com if you're an adjuster or a patient care provider, a doctor, a nurse practitioner, PA, saying, hey, I'd really like to try this for one of my patients. Feel free, you can send that in directly to us.
Wonderful. Well, it's been great having you both on the show. Thank you so much for stopping by.
Hey, thank you.
Thank you.
Fun.
Thank you for joining us on Workplace MVP. R3 Continuum is a proud sponsor of this show and is delighted to celebrate most valuable professionals who work diligently to secure safe workplaces where employees can thrive.